Hey, you know what this should be called? Thank you. Thanks for coming. You know what this should be called is how to not only get rid of bad habits, but how to increase good ones. And I've got to tell you the story that happened. Need some donkey? Okay. I did this workshop last December, and I called up this lady, and she says, "You know, Doc, I don't know if you go to your workshop this year." I go, "Wow, really? This really happened on Tuesday." I go, "Well, tell me why." Because I know how to do it. In fact, I could probably teach you. No, she didn't say that. I said, "Tell me how it benefited you." I never thought about this. Well, I did, but I didn't. She goes, "You know what? I'm in real estate, and I'll tell you, business has been, well, I won't say what she used. It hasn't been good for the last few years, and she hasn't got any sales. And she used this technique to increase her money, her sales. She really did. And her sales in 2011 through the roof for real estate. That's pretty good. I mean, so you can use this to get rid of bad habits or increase good ones. Whatever you want to do, it's up to you. And before we talk about how we do this, because this is kind of a technique that's been around for about 30 years. I didn't invent it. Roger Callahan, a psychologist in Palm Springs, discovered this. I'll show you how we did this in a second here, but as you know, that chart here that you see here, this is why we're all here, because we want to stay healthy, right? We want to stay healthy and live as long as we can. And so that's how all these organs are working. It's because through the brain sends messages onto the organs, and that's how you maintain your vitality. And when there's a misalignment, we call these subluxations. A bone goes out of place and hits the nerve, and that organ will get malfunctioning. The problem with this all is when that bone is sitting on a nerve, is there any pain? No. 90% of the time there isn't. That's why a lot of times people say, you know, I feel fine. But that bone is sitting on a nerve. 90% of the time, you'll have zero pain. But 100% of the time, that organ will be deprived of that brain flow to that particular organ. You can eventually get symptoms, you get diseased. You really will. And so when you look at this chart here, you go, yeah, you know what? Sure, that makes a lot of sense, right? I mean, I can see how I mean, that's from an anatomy textbook. I didn't, make this up or anything like that. You know what? I can see how that works, but you know what? I want some empirical proof. Give me some evidence. 1/3 of the people in the United States will die from some sort of heart attack, some kind of heart disease. That's crazy. 1/3 of the people. And how many people, I've been practicing for 30 years under my care, how many people died under my care with a heart attack? Anybody? Zero. Not 1/3. Is that a coincidence? I don't think it is. Cancer. What's that gentleman who died a couple of months ago that owns Apple? What's his name?
Steve Jobs.
God, he was what, 56? Wow! He had what kind of cancer? Pancreatic. Oh, that's terrible. I don't think we're made to die at 56. How many people died under my care that I know of? I've had 2 people come in with cancer, and this gentleman with a jaw thing, I'm not sure if he had cancer before, but I certainly have lost 1/3 of my patients to cancer. So I guess what I'm trying to say is most of your patients here, if you're not a patient, you should, because you're missing out on the big part of this, is you want to stay healthy and alive, and you want to have, my dad died when he was 80, and maybe that's a ripe old age. Are you kidding me? He was sick for 15 years, the last 15 years of his life. He was always sick, he's in the hospital, he had this, he had that. What kind of quality of life is that? I mean, I don't get that. That's not what I want to have. If I'm going to live to 80, I want to have good quality life, and this is the answer here. So let's see, we're going to start off by looking at the first page here. Who's a good reader here? Stefan, you're a good reader. Read what Thomas Edison said in 1880, not 1980, 1880.
The doctor of the future will be no medicine, but will interest her or his patients in the care of the human frame and in a proper diet and in the cause and prevention of disease.
So he said that in the 1880s, and I think I'm doing that right now. So the doctor of the future, can you turn over you'll see that there's a couple of diagrams here. Now that one on top there, since you did such a good job, Stefan, you want to read what that says there, underneath that triangle?
Man possesses the potential for recovery through the innate intelligence of the human structure.
So Dr. George Goodhart, the founder of applied kinesiology, said that. He said structure. Thomas Edison said frame. That's the same thing. So what that means is if you look at that triangle there, you'll see structural, mental, and emotion, and chemicals. So everything hinges on that triangle. It's an equilateral triangle. You see it's not lopsided. And you see structures on the bottom. And you know, it's not like it's there by a fluke or a coincidence. Everything will hinge on what Thomas Edison said and what George Goodhart said. Everything relies on the human frame or the structure. So if you have a, let's say, a chemical imbalance, of course you have a structural imbalance. If you're both sitting on a nerve, you're going to have problems with your organs and eventually pain in your back. But let's say there's a chemical imbalance. You know what's really common is like, let's say, a calcium deficiency, for example. I mean, men and women. If you're low in calcium, which is really common, for whatever reason, either not taking the right calcium in, the amount, or maybe not even absorbing it, for that matter, what's going to happen, because your muscles really rely on calcium to make them nice and loose. If you're low in calcium, they get nice and tight. And you walk around like this, of course I'm exaggerating a little bit, those bones are going to be yanked out of place because the muscles are tight, not enough calcium. And then before you know it, you got the structural problem with misalignments. See, already it's trickling down to the structure. Emotional, let's say you had a fight with your significant other, or someone cut you off, or you got road rage on freeway. Well, then you're psychologically reversed. We'll show you how to get rid of that. But it's going to trickle down to the chemical. For example, let's say you're all upset because someone cut you off on the freeway, and you're mad. Well, instantly, the hydrochloric acid secretion in your stomach is going to come to a screeching halt. And then the calcium, getting back to that for an example, won't be absorbed in your system. Your muscles are tight, bones go out of place. So it keeps on going around in the vicious circle. So, but always wind us being the structural problem is what people have at the end when all this is done and over with. And those circles you see there are things that you need to do to fix that. So N is nerve on top, neurolymphatic is NL. By the way, that's what we'll be doing next month is how to treat your hormones. NV on that circle there is neurovascular, cerebrospinal fluid is the cranials, and AMC is acupuncture meridian connector. Today we're going to be talking about the mental component of the triangle. Now, most of you who are patients, you can see when a person comes in and we stick out an arm or something, and if you touch something on their neck or back, if there's a misalignment, for example, what happens, and the person's touching it, or if I put my hand there, what happens to that strong arm? It's going to go right. All that tells me is there's something wrong in that area. Now, most of you had some kind of nutritional testing here. Let's say if you have a strong arm and you put a supplement in your mouth that your body doesn't want. It's the wrong kind, it's not good for you. While that supplement's in your mouth, what's going to happen to that strong arm? It's going to go right. How our body works on the mental component, if you say something detrimental, let's say, I want to have a crummy life. The normal response, and if you say, you can say this or verbalize, it's kind of funny when you think about it, right? But that's how this whole thing started. I'll show you how this, if you say something derogatory, like I want to have a crummy life, and I say that under normal circumstances, your arm will actually go, what? Roger Callahan is a psychologist in Palm Springs. He was treating this lady that was 30 pounds overweight. And everything he did, she was actually putting on more weight. He couldn't figure it out. So what he asked her to do is think about being 30 pounds less. Now, what happened to her arm? Instead of staying strong, she actually went weak. Whoa, that's not normal. And then he said, okay, think about being 30 pounds heavier than what you are now. She actually got stronger. Well, see, she was psychologically reversed. So what that means is your subconscious is not congruent with your conscious mind. You want to lose weight consciously, but subconsciously, you don't. So it's like a self-sabotage. That's huge. Now, many people in here may not have that, what we call massive psychological reversal. But I'm going to test someone for that today, because if you want to be happy and healthy and have a good life, you want to make sure you have that. Some of you may not want to have that today and don't even know it. So what this is a constant belittlement of yourself. It's an ongoing thing that your self-esteem is low. You don't even know it. Now, I've mentioned that to a couple of people this week, and their face just lit up. Oh, that's me. So this is not that uncommon here.